This is the last module in the Will It Work For Me series in our psychedelic master class. In this section, we are going to be talking about something very near and dear to my heart. It is our real world client outcomes. So in the last module, I walked you through several of the clinical study results that have happened, a curated collection over the past many years. But now we're switching gears a little bit, right? We are going to talk about the actual client results that we are seeing at our center, and to a lesser degree across all of Oregon in the regulated program. So let's just dive right in. We have seen almost 500 clients since we have been in business, we meaning Fractal Health and Fractal Soul. And our positive outcome rate has been absolutely phenomenal, right? And it has grown over time, of course. But it is very typical to see clients walk into our center for their session with a certain suffering, like depression symptoms, anxiety symptoms, grief symptoms, substance misuse, those sorts of things, and walk out simply no longer feeling that suffering, right? And I don't mean to overpromise this as some miracle cure that magically fixes everything permanently. It's not. But the difference in people when they walk in the morning and when they walk out in the afternoon is like night and day. And it is actually one of the things that keeps me going in a very difficult industry sometimes. I do want to talk about the fact that there's a natural contracting effect that happens as one returns to daily life after a psychedelic therapy session. And this is where integration becomes crucial, right, to achieving sustained results. If a client's mindset is, well, that was nice, now back to the norm, like they went on a vacation and now they're back, then of course nothing's going to change. They have to put effort in to altering their baseline and their norm. It's important to know that there's a 2 to 3 week window of brain flexibility, right? We talked about in the neuropharmacology section, we talked about the fact that this is a psychoplastogen, and that means that the brain is going to be a little bit more malleable over time, right? Well, there's a 2 to 3 week specific window where it's the most that is the most true before the sediment starts to kind of settle again, right? Researchers a lot of times talk about shaking the snow globe. And so the sediment is disrupted for a while where it's gonna settle again and it's gonna re-harden again. And so there's a period of time where you can work to reprogram thoughts and habits. And we always urge our clients to take advantage of this window where this sediment has been disrupted and the mind is more just naturally more malleable. And you'll notice that you have more control over your habits and your thoughts during this window. And so it's a great time to practice various integration activities. So integration's outside the scope of this training, but just wanted to mention that one of our favorite terms for returning to daily life is after the ecstasy comes the laundry. In fact, there's a book of that title that I absolutely love. Going through a psilocybin journey isn't really about living in that state permanently, right? We can't live in an altered state of consciousness all the time. What it's really about is resetting those brain's rigid patterns, as we discussed, and then working to make those positive changes a daily reality on the other side. But at any rate, let's talk about our overall results, right? Without further ado, 95% of our clients, I kid you not, indicate that their dose and their experience hit the therapeutic sweet spot and leave them feeling like their intention has been mostly or fully addressed. Now, remember that we're using the term intention here, right? We're not using things like diagnosis or treatment, not formally, because psilocybin services in Oregon do not operate under a medical model. So an intention is simply a goal or a desire that a client has of some desired change in your life. And it's as simple as that. So of course, the most common intentions we see are to address things like treatment-resistant depression and anxiety and complex trauma and grief and substance abuse and feeling stuck or burnt out in life or getting clarity on a major life decision. Those are all very common intentions, but we don't treat them like a diagnosis. We treat them like a symptom that you are trying to alleviate. Now, there are a small number of clients for whom their experience is underwhelming or overwhelming. So I want to go through those as well, right? This is the 5% that this does not have a positive outcome. Now, About 3% indicate that their dose was more underwhelming than they expected, or they do not achieve the results they had hoped. In fact, this might be, of the 5% breakdown, this might be more like 3.5%, because the overwhelming is the 1.5%. But it is much more common to have an underwhelming result than an overwhelming result. And this is almost always due to the serotonin blunting factors that I talked about in the dosing dependent outcomes episode or module. So there have been several clients that we have dosed at the state legal maximum dose of 50 milligrams of psilocybin analyte, which is roughly double the dose of most clinical studies. And clients on a complex array of psychiatric medications or sometimes pain medications may still feel very little because their serotonin receptors are almost completely downregulated, and these clients may need extra disappointment management support, right? I sometimes use the analogy of, like, imagine that your serotonin receptors are it's like a dock, right? And you send a bunch of boats upstream, but if the dock is closed, the boats don't have anywhere to land, right? And so you can send all the psilocybin into the brain and into the body, but if the serotonin receptors are not available to receive them, then you're not going to get the therapeutic benefit. And this doesn't mean that you're a bad person or that this, a lot of people will internalize this and think, well, I'm just irreparably broken. And it's not. It's a very physical reason beyond this, right? So these clients really, a lot of times, will need extra disappointment management support. And interestingly, we find that sometimes when people, even when they have underwhelming journeys, they will notice afterwards that their brains are still changed and that their emotions are still changed, right? So even if you have a little bit of a disappointing session in the session, pay attention in the days and weeks following to see like how your brain is changing anyways. So that's one portion. Then there's an even smaller subset of clients, right? That, there is a small subset of clients, maybe around 1 to 1.5%, who end up resisting or rejecting their own journey experience that they signed up for and that they paid for. So resistance is a natural phase of onset with psilocybin. Everyone goes through it, even experienced practitioners, but it typically is transient and it lasts only between maybe 5 minutes on the low end to maybe like 45 minutes on the high end. But some people choose to resist or reject their entire journey. They just refuse to participate in the thoughts and the feelings that naturally arise. And when this happens, clients mostly express disappointment and regret at the tail end, and they'll oftentimes want to come in to try again, right? And then interestingly, that second time, they're like, okay, I know the deal now. And almost always, people who resisted the first journey knock it out of the park with the second journey. But this is one reason why preparation is key, right? It's to begin opening yourself up to your own thoughts and feelings, getting ready to accept, surrender, go with the flow, and then just knowing what to expect. Like, what does a journey feel like, so that your fear and your anxiety is really lessened as you come into the experience. Now, regarding pharmaceutical medications, it's really about being on a combo of medications that increase risk of complete desensitization of serotonin receptors, right? And at least 50% of our clients are on an SSRI or similar medication, right? And they still have fantastic results. In fact, a lot of clients have been able to get off of their SSRI type medications after a psilocybin journey, which is a huge, huge win. Maybe not for pharmaceutical companies, right? But it is for us. And so I champion and celebrate whenever that happens. Of course, I do want to say we're not medical providers. I can't give you medical advice. I would never, it is far outside our scope of practice to try to help you titrate off your SSRI directly. So please, please, please work with your actual medical provider who provided you this prescription, whether it's a doctor or a psychiatrist or whatever, to do this, right? That's outside of our scope of practice, but we do receive lots of reports back from our clients saying, I was able to kind of slowly get off my SSRIs, sometimes after being on them for decades, which is very exciting. And then finally, there's the last subset. This is about 2% who indicate, maybe 1.5% now, because we're getting better with dosing, that they indicate that their dose was actually more overwhelming than they anticipated. And so these people they really need, they're just more sensitive than what we thought, right? People will always surprise us. And so these people really need a lot of facilitator emotional and physical support during the journey. And even with this intensity, though, we have yet to have one client experience that is thought of as what most people think of as a bad trip of just complete breakdown of paranoia and panic. That has never happened, even if people are feeling very, very overwhelmed. So nevertheless, there are many other ways that a psilocybin journey can be very challenging, right? So if this does happen, please know that you are with professionals who have literally seen, heard, and or done it all. They know what you're going through and they know how to support you. They're trained professionals. They're not just a buddy sitting in the room with you, hoping that everything goes right, okay? An inadvertent overwhelming experience happens when a client is, as I said, more sensitive to psilocybin than we anticipated during the preparation sessions and all the questions that we ask to try to like hone in on our best guesstimate for how sensitive that you're going to be. And we have learned about dosing strategies over, as I said, hundreds of clients. So this overwhelm rate and actually the underwhelm rate too, those have narrowed over time. And it now does hover around maybe 1.5% to 2% of clients that state that their journeys were just exceptionally difficult. Interestingly, upon checking in with these clients like 2 to 3 days later, they still claim that their experience was one of the most profound, positively profound experiences of their lives, and that they got immense benefit, but they might not feel that way during or immediately after the journey. So if you do have an overwhelming or a harrowing journey, it's just important to know, and I've been there, I've had those as well. It's important to know that the feeling does pass quickly when psilocybin is gone from your system, which is typically about 5 to 6 hours. So the best thing to do is to be around support if you need it, to just get a good night's sleep, to rest the next day. Don't try to do any heavy thinking or physical activity that very next day. And usually by the following day, you'll be feeling pretty much back to normal, maybe even grateful upon, like retrospect for the experience. That next day, if you've had a really heavy dose or a heavy experience, it's pretty common to still feel fatigue, and it's pretty common to still feel like some brain fog, like you just can't think to the best of your ability. But again, usually 1 to 2 nights rest, like it kind of like that's your recovery period. And as I said, not everybody feels that way, right? A lot of people feel amazing immediately after their journey, and then the next day they just feel like $1,000,000. So I'm kind of just sharing this with you to help you understand that there's a very wide range of experiences, and then also like recovery periods. But recovery doesn't take a week. It's not like a surgery. It's like 1 to 2 days max, I would say. Now, we mitigate this risk of an overwhelming experience by having clients take usually a slightly lower initial dose, but then they can purchase what's an optional, it's called a booster or secondary dose. And this is usually taken around the 1 hour mark, only if they're feeling very little, right, at the 1 hour mark from their initial dose. And there's a little bit of like an art to this as well. At 1 hour, your initial dose is not at its peak yet. But at 1 hour, that's usually a good timeline where we can make a decision, the facilitator and the client together, whether a client definitely needs it or definitely doesn't need it, or is in that gray area, right? And so the booster dose also is usually we'll sell someone a booster dose of say 12 milligrams, but we break that up into 4 milligram increments. And so at booster time, people have options, right? You can just take a little bit if you're feeling like you need a little nudge, or the 8 milligrams, or like if for some reason people are like, I'm feeling nothing, I'm feeling very little, they can just take all 12 as a booster dose. So it's really, really helpful to have that secondary dose on hand. And like I said, be aware that your initial dose will keep climbing up into the 2 to 3 hour mark, but at the 1 hour mark, you should be able to gauge how that initial dose is doing in your body. And having that booster dose on hand, it really just helps modulate, right? Getting the correct total overall dose to the client without needing to be 100% correct on the initial dose. I would say roughly 25 to 30% of our clients end up taking their booster dose. And when we first started, it was more like 80%. Everybody needed their booster dose, but we're getting better with our initial dose as well, right? So it's just helpful to have that booster on hand. So I know I'm getting a little bit into like dosing strategies here when we have a separate training session on dosing, but just given that this section is about our real world results, good and bad, I wanted to explain the reasons why clients may have under or overwhelming experiences, how infrequently they do occur, what we do to help mitigate those. So as you can tell, our results overall are exceeding clinical study results. And this is pretty remarkable given the fact that we also take a far wider range of individuals and conditions than a typical clinical study would accept. And I believe that there's a couple of factors playing into this high success rate. Number one, the entire experience is personalized and feels personal, right? And as I've mentioned before, we have a 9-facet success model that every single element of that model is personalized to the client. So the setting of the administration session is cozy. It doesn't feel clinical at all. People can choose the theme of their room that they want, so that's personalized. We have designed our experience and our center to be nurturing and supportive down to the very last tiny detail, right? At least to the extent that we can, while remaining, of course, in full compliance with Oregon state law. But clinical studies just simply don't have this feel. And number two, we're able to personalize the dosing plans for each client, whereas clinical studies usually require the same dosing. It's usually 20 milligrams or 25 milligrams for each participant. And I've even seen a few weight-dependent dosing studies, which is irrelevant because psilocybin dose is not body weight dependent. And apparently, some researchers are unaware of this fact, but we have found that people are wildly different in terms of their sensitivity to serotonin and thus psilocybin. So as examples on either end, our most sensitive client to date has launched fully on just 8 milligrams. And when I say launched fully, like to this person, they were having an experience that was similar to like a 24 to 28 milligram, like a classic journey experience. And our least sensitive client felt nothing on the full state legal dose of 50 milligrams, but crazily, this was with a strain that also contained a huge amount of psilocin. And Oregon state law does not require us to, we do potency test psilocin, but we don't have to accommodate it in our dosing regimen or our sales. So this particular strain, we sold him 50 milligrams of psilocin, but there was an additional almost 50% extra of equivalent psilocin, making the total dose equivalent closer to like 70 to 75 milligrams. And this person felt nothing. I'm not kidding. I mean, not even a little flicker. And so there is such a wide range, right? And but it is important to know that, again, this is on a bell curve, just like anything in life. On average, a 24 milligram dose is great for a lot of people. That's our most popular dose. Sensitive people may need closer to 12, desensitized may need closer to 36, right? So plus or minus 50% there. But our facilitators spend ample time discussing these factors that could influence dosing strategy for you personally, and clinical studies just simply don't accommodate this. So this is one of the reasons why we're seeing such high positive results. And the third thing is we provide ample preparation time and also ample integration support. And that's also personalized, right? But with an underlying standardized content to ensure consistency and quality between clients and also between facilitators. So wherever possible, we ensure that clients are also being supported by another mental health professional, such as a therapist that they like and trust. And most clinical studies will include maybe these sessions, but it's kind of more of like the bare minimum, right? And it's probably with somebody that you don't know and haven't established a relationship with. It's important to note with depression in particular, this condition can be harder to address, and it's not because psilocybin is less effective at alleviating depression than anxiety. It's because these clients tend to be on heavier doses of serotonin impacting psychiatric medications like SSRIs. And a lot of them have been on medications for these years or decades, right? I facilitated for one particular client who had been on Prozac for over 40 years. I'm pretty sure, I don't even know when Prozac came out. That had to have been about when Prozac came out, right? So just sometimes you've been on these meds for so long and the serotonergic system has been chronically assaulted. And so now it's just sluggish and desensitized. So it's important to know that psilocybin works equally well in a standardized sensitivity brain, but in brains of people who have a desensitized serotonergic system, whether that's through medications most commonly or sometimes just genetics, the results can be somewhat muted. So if you have depression, the answer of whether this works for depression is yes. But whether it will work individually for you will likely depend on your history of medications taken for depression and the length of time, right? Having said that, we successfully treat people on 1 to 2 types of medications regularly. So don't lose hope if you're on an SSRI or an SSRI and something else. You likely don't even need to taper off before commencing with our program. But your risk of having an underwhelming psilocybin experience increases exponentially if you are on 3 or more serotonin impacting medications. So that is just something to know about. This next section I have is case studies. These are my favorite case studies that involve a man and a woman, both in their 60s. I mean, separate, they don't know each other, right? The man was brought in by his son for complex trauma. He had been physically and sexually abused as a child, and he was also a combat vet and had trauma from, of course, witnessing violence in the military. He actually came into a different center the first time, but it was reported that he resisted most of his journey. And so he came to us next wanting a different setting and to kind of like try again, right? He was able to, without going into too much detail, really successfully embraced his journey, which for him meant sobbing for, I think, 5 hours straight. I've never heard someone sob so long or so much. But when he left, he said he felt peace for the first time in his life. I mean, he had a smile on his face, and he hugged his son, and his son was like, my dad's not a hugger. What's going on, right? So the son reached out to us a few days later, just thanking us and saying, I've never seen my dad like this. I've never seen him so at peace. Thank you so much for what you do. I feel like you gave my dad his life back. So that's one case study. Second case study was a woman in her 60s who also had severe lifelong treatment-resistant depression and had tried everything under the sun and nothing worked, or things just worked for a little while that she, like new medications, right, that she would try, they would just stop working after a few months. And while most people's depression results in a feeling of flatness or numbness, this person's actually presented as uncontrollable sobbing spells that would just hit her suddenly out of nowhere, including in very inappropriate contexts, like at work, right? And she didn't know the reason she was crying. She could never pinpoint it. She would just feel an overwhelming need to cry. During preparation, she shared that as a child, she was punished and she would receive messages from her caregivers like she was bad, right? You're a bad girl. And she had deeply internalized this message. So it was interesting in her session, which was a little bit more on the intense side for her, she described dying 1,000 deaths was what she said. And she also said, lest that sounds scary to you, she said that all needed to happen so that I could be reborn in all of them. And it was so beautiful to hear her say that. She actually didn't do as much crying that we had all anticipated, right? Because she cried so much in real life. I just assumed she was going to sob the whole time, but she didn't. She was pretty quiet. She was able to reprogram the internal belief, though, that she was bad by nature. And she was able to let go of the shame around still feeling like she was a bad person and a bad little girl. She was able to heal her inner child, and she made peace with her inner little girl. And interestingly, she left feeling just incredibly grateful, if a little shaky. And when we checked in on her a few weeks later, she reported that her sobbing spells had stopped, just like that, for the first time in her life. And she and her husband are just so grateful. Their quality of life has improved dramatically. And she was also able to keep her job as well, which just was wonderful for her because she loves her job. So I know everyone likes these inspirational stories. So I can do them all. I could keep going all day. There are so many people that we've helped who are so incredibly grateful because they have changed their lives powerfully in one afternoon with us when nothing else that they tried worked. This is the power of psilocybin and being in an expanded state of consciousness with a brain that is fully communicating between global regions, while the internal switchboard operator controller, which usually tells what parts of the brain can and can't talk to other parts, is kind of temporarily shut off, right? So, these are the success stories that we love to see and we love to share with the world to give people hope here. I could go, like I said, I could go on and on. There was a young mother just recently who was suffering from binge drinking and wanted to be a better wife and mother, and she was able to come in and have a wonderful session. And to my knowledge, she has not touched alcohol afterwards, right? I mean, I could just go on and on with dozens of these stories. But another thing that I would just like you to be aware of is that clients frequently receive additional unintentional benefits beyond their original reason for seeking treatment, right? That they hadn't even thought of. So a few examples. A late 40s woman came in to address chronic generalized anxiety, and she ended up treating a binge eating disorder and her relationship with food, which wasn't even on her mind. A mid-30s man came in to address OCD and found after his session that a bizarre yet prolific sweating problem he had had for years had disappeared. An early 50s man came in to address depression and had a pretty underwhelming, disappointing experience like we talked about. He didn't feel a whole lot, mainly due to complex list of medications he was on. But in the days following, he reported having a very calm nervous system and countenance, which was absolutely not typical for him. And finally, an early 30s woman came in to address childhood trauma and ended up having an overwhelming adverse experience. And we had to really step in for her own safety and help her. And we would have thought that this would have been just an adverse experience overall. But in the days following it, she actually reported that she wanted to live for the first time since she had been a teen and that she felt peace. And even though she took such a heavy dose, this actually wasn't that much of a dose, but again, she was one of those people who was just way more sensitive than what we thought. She didn't remember much of her session, but she reported having a happier relationship with her inner child. And she knew that she had accessed areas of her mind and her memory that she had been unable to access through any other form of therapy. So the overall results that we're seeing are simply phenomenal, right? Psilocybin works and it works like nothing else available in the world of mental health treatment today to resolve core wounds and traumas, to free individuals from a lifetime of suffering. That is the promise of psilocybin. It is not meant to be done all the time. It is not a miracle cure, but it is meant to be utilized as a powerful tool when intervention is necessary. So one thing I want to cover is that psilocybin therapy does not have a demographic stereotype, right? You might assume that the only people who are interested in psilocybin therapy are hippies from the 70s, or young people who just want to have fun, or even more liberal people who are more pro-drug in general. But none of these things are actually true. So I want to share some center statistics from our own direct client base. In terms of demographic data, gender is pretty split evenly, right? There's 51% women, 47% men. So this is a very popular mental health treatment for men, when men a lot of times will not access other forms of mental health. And non-binary gender has been reported at around 2%. We also serve 10% of our client base have been veterans. 15% of our client base have self-identified as LGBTQ+. 15% are low income. 31% are Western religion, which is Christian, essentially, because we ask them, what religion they belong to. So this is really important because I think a lot of people assume that the people who would do this are not religious, or maybe they're just spiritual. It is true also that Eastern religion, we ask that question as well, primarily Buddhism is 17%. But Christians are over twice the amount of Eastern religion clients that we see. The most popular age bracket is 40 to 49. It's squarely in that midlife bracket, but equal second place are people in their 50s and 60s as well. And return clients has been just 5%. And that's a positive thing, you guys. It's not because clients are unhappy. Go look at our Google reviews. People are glowing about it. The 5% is because it means that most people only needed one session to really, truly feel better. So just to recap, a single therapeutic intention session with psilocybin, right, which has three parts, the preparation and the integration support on the other side, on each side of your administration session, that has been consistently shown to improve a wide variety of mental health symptoms and behaviors. It's been shown to be more effective than traditional talk therapy or medication, although it certainly works great alongside those modalities, especially talk therapy. The reason that psilocybin therapy can be more effective is because it encourages clients to address the underlying causes of mental health, such as old emotional wounds, right? And I've gone into this in other videos, but we call this active coping. And it's the opposite of what SSRI medications do, which is called passive coping. Passive coping is the serotonin 1A pathways that SSRIs have affinity for, and the 2A pathway of serotonin, that is what psilocybin has an affinity for. The 2A pathway is more aligned with active coping. So this is more about having someone actively resolve their pains. Passive coping is just about like increasing tolerance to pain, right? And accepting what is without really trying to resolve it. So this is the process of active coping that leads to permanent healing, growth. And the things that predictably reduce efficacy of psilocybin treatment are when a client is on 3 or more serotonin blunting medications, or is especially isolated, they lack at-home support or community belonging, or lastly, has not faced underlying feelings or their inner world much at all, increasing the chance of resistance during initial journey and often necessitating follow-up sessions.